Good eftermiddag. You are listening to Prevention is the New Cure, all things health and politics.
And that's with me, Dr. Helen Stokes-Lampard, and Steve Bryan, MP.
Hello, Helen.
Hi, Steve.
More on my rather bizarre introduction later on, but nice to see you. This is episode 30. Last time we had Dr. No, not Doctor. I was getting ahead of myself there. We had Lord James Bethel guesting because you've been away, and welcome back, Helen.
Thank you so much. And I'm glad you had fun with Lord Bethel. Sorry to miss you, chaps. But I hear you had plenty of fun without me.
Yeah, well, we had some fun, and it was really nice to see James. And he's still there as episode 29 on the pod. We talk about lots of different things. Got interrupted by lots of votes because there were two members of Parliament on the call instead of just me normally messing it up. But anyway, yeah, it was good. So listen, this is episode 30. We've got so many things to get through today. On our agenda, we're going to talk a bit about COVID-19, which is both professional and personal, and talk about Coppafeel breast cancer charity, bit of news on that, and then we'll talk about our travels because I'm still traveling and you have been a long way away, so we'll talk a bit about that. We're talking about birth trauma at some point, which is a big story on the news this week, about obesity, and then we've got a couple of things come up in pod surgery. So right back at the top, COVID-19, Helen, I hear that you are, this is personal and professional for you today.
Oh, Steve, don't. First of all, I'm sorry I abandoned you last time, and I had a very good excuse. I have been traveling to New Zealand, and we're going to talk about that in a minute, because I got to visit health facilities and learn about what was going on there. But yeah, apologies if I cough. On the journey home, I've clearly picked up COVID-19 again, which is so tedious, and it is so 2020, and it's almost embarrassing to admit it. But I did a test because I was due to be in clinical practice on Monday, and I'm really irritated. Interestingly, we have got an upswing of COVID again now. So have you heard of any other people coming down with it recently?
A few kids, actually. I mean, I can understand why you test because you're a clinician. And if you've got any symptoms that put a red flag in front of your eyes, you get the test out, right? And I'm assuming that's part of your professional guidelines. But I don't really understand why school children, anybody else in society is. I mean, other than, if you've got a sniffle and you've got a cold, it could be a sniffle and a cold. It could be COVID. But ultimately, you can't stay hibernating because of it, can you?
Exactly. And the guidance now is not to test. So I tested because of professional curiosity. And I think there's always that feeling as a clinician when you're dealing with the vulnerable public all the time. I knew I was going to be seeing patients on Monday who are going through chemotherapy at the moment and so on. And obviously, we should all be using appropriate precautions if we have got coughs and colds and sniffles to ensure patients are protected. But I had the test sitting in the bathroom and I thought, I wonder. And in fact, slightly embarrassingly, I thought I had started with hay fever on Sunday night when I developed sniffles. It was only on Monday morning when I was drenched in sweat that I thought I didn't know hay fever could give you a sweat. So my super GP diagnostic skills were what made me think, I wonder. Anyway.
Poor you.
Oh,
and apparently, what I do know is that this variant is called flirt. I presume that's an acronym.
It is an acronym, Steve, and I have been teased mercilessly for being a modern flirt. But yeah, actually the microbiology or the virology bit is quite interesting. There are a whole heap of variants that have independently picked up on very similar mutations, and they've collectively called the flirt variants. And I got flirt is just a technical name for the mutations. It's not some fancy acronym that's worth repeating. But the problem is with new variants, as we know, it means reduced immunity for everybody. So COVID levels have actually been really low for the last 4 months, the lowest they've been since the start of the pandemic. But now we're predicting quite a big summer uptick again because natural immunity has waned. Vaccine-induced immunity has waned because for most people, other than the most vulnerable, they haven't had a booster for a long time. So yeah, just be aware. It might be COVID, but like all things, as you said, any viral illness, take it easy, rest, do the sensible things. Don't do as I've done and continue working like a lunatic. Get the paracetamol fluids in bed.
So UK health security agencies say that numbers have ticked up for the third week in a row.
Uh-huh.
But what do we know about this flirt mutation? Then presumably they're going to tell me that it's more infectious than the last.
Well, not particularly. It's just that the natural immunity has waned. So a lot of people are going to get it because background immunity has dropped, whereas we were all pretty immune to the previous variants. So yeah, it doesn't, at the moment, I'm not aware that it's any more serious than previous variants. But obviously, a lot of people would have had previous ones and not known they'd had it, whereas this one is likely to cause symptoms. So bit annoying,
Okay.
bit annoying.
Yeah, well, feel better. You do
All right.
look coldy, I must say.
Thank you.
I
The
know
red
viewers
nose that
can't
gives
see
it
you.
away.
Yeah, you do look a bit coldy. Bless you. Copperfield.
Oh, Steve.
So when you were away, this news broke. So those of you who don't know, Coppafeel is a charity, a breast cancer charity, appropriately named. I love the name of the charity. That's what attracted me
Brilliant.
to it, right? Because I just think it's a brilliant name for a charity. And I was chairing the All Party Breast Cancer Group at the time, and so I contacted Copperfield and said, I'd like to get to know you. How can I help? And this rather crazy, bubbly young lady called Chris contacted me, and this was about 10 years ago, and she was 28 then, so she was in her late 20s, and she explained her story, which is that she suspected something was wrong. She went to the doctor several times. She didn't really get anywhere, and
Yeah.
and eventually, she was diagnosed with terminal breast cancer, secondary breast cancer, and so I wanted to help Chris, and I said, would you come to Winchester, my constituency? Would you come to Winchester and talk to the assembly of the students in the secondary schools? And she said, how many secondary schools have you got? And I said, there's 3 in the city. And she said, okay, I'll come, but only if we do all 3 in one day. We did all 3 in one morning, and one after the other, we bounced from the 3 different secondary schools in Winchester, King's, Westgate, and Henry Beaufort, and she was brilliant. This beautiful, glamorous woman who basically started the conversation in front of a packed school assembly. You can imagine a lot of them
Yeah.
too cool for school, and she basically started the conversation by saying, "Hi, I'm Chris, and I'm dying of breast cancer."
Wow.
You could have heard a pin drop.
Yeah.
And she talked to them about her story, and check your boobs, check your chest,
Mm.
and guys, check if you happen to be touching any
Yeah.
boobs, check the boobs. And so she did that, and it was incredible. And I hope we did a little bit to raise awareness in Winchester. And sadly, Chris lost her battle. Although, actually, let me correct, she wouldn't want me to say that. Breast cancer got the better of Chris last week, and she died aged 38. So very sad. But what a legacy! She turned something horrendous into something so positive.
I mean, I never had the privilege of meeting her personally, but I know her work. And I honestly, I think I said on social media, the world's a better place for her having been in it. And yeah, I just hope that her family and friends can take some comfort in that.
Yeah. Well, if you wanna find them, we'll pop the link to Coppafeel as we did on our social media when the news of her death was announced. But we'll pop it back on the trail after this episode, and there'll be many more things. In fact, there's an event next week in Parliament that Coppafeel are doing. I met with them last week in Parliament with some of the girls who've been involved in it since the start, and were actually with me that day in Winchester, and they were obviously quite emotional, but determined, absolutely determined. I said, I did wonder if you'd still come to the meeting today, or you postpone it. And they said, what do you think Chris would have said? I said, right, I
Yeah,
know what
see you
Chris would
there.
have said.
Yeah.
So anyway, we cracked on, and we will carry on with the mission to try and raise breast awareness, or chest awareness, I think, as they put it.
Yeah.
Anyway, R.I.P. Chris Halenja of Coppafeel. So you're back. You said you've
Yes.
been in New Zealand.
Mm.
Which one, north or south, for a start? And why were you there? What have you been up to?
I've had an amazing holiday in New Zealand, Steve. It's been just awesome, but I crammed a bit of work stuff in it as well. So,
I can
in answer
imagine.
to your question, so yes, my Antipodean adventure was mostly based in the North Island. I did a quick trip down to Christchurch to see the medical school and the hospitals down there, but most of it was North Island, but did tour around. So Paul, my husband, and I had a few days in Auckland. Then we drove up around Northlands. Then we went out to the Coromandel Peninsula. Then we flew down to Wellington. And then we drove our way back up through the North Island and got to see some of the amazing sights. It is an awesome country. And I would love to spend the whole time talking about beautiful New Zealand. But I thought we probably should focus on the health and the prevention angle for the podcast. Have you ever been to
Yeah.
New Zealand, Steve?
No, although my brother-in-law and his wife and their three sons have relatively recently emigrated to New Zealand.
Have
She
they?
is a GP like you, and he's a teacher, and they got three very outdoorsy boys, and so they moved to New Zealand. Yeah,
Which
last
part
year.
are
It's
they
very
living?
sad for us in a way, but they're happy. They're in Christchurch.
Christchurch. Okay, Christchurch is very beautiful. So
So I
yeah,
know nothing other than you, but I mean, I presume there's lots of interesting stuff around the is it the Maori people? It's
yeah,
described as how you pronounce it, isn't it?
yeah, Maori. Yeah, it was absolutely fascinating. So look, very quick history. Back in 1840, British colonizers signed a treaty with the majority of the Maori peoples, the Treaty of Waitangi, and it basically was intended to do far better than British colonizers had done in other areas and come up with an arrangement that would allow for peaceful, safe collaboration going forward. And now there's been controversies, and the treaty wasn't always honoured, and so on. But essentially, it means that the Maori have very strong legal rights, far greater than in many other areas of the world. And they represent about 17% of the population of New Zealand nowadays. 70% is white European descent, and the rest are a mix of Pacific Islanders and South Asians. So it's quite a diverse society. But the Maori are unique in having these legal rights to basically prioritization of their well-being and health needs. But as it stands, they've got far worse health outcomes than the white European population. So they've got high levels of obesity, poverty, smoking, drug abuse, alcohol, all the usual things, which of course means in turn they've got a lower life expectancy and all the chronic diseases that go with those behaviors. So there is massive recognition of this. And what I saw was amazing work going on with partnerships between the Maori tribes and local communities in particular to put it right. So I just know you'd find it fascinating. And they talk about New Zealand being a bicultural society, not a multicultural society. Um, anyway, it was fascinating. And I just thought you'd be interested in that.
I'm really interested in that. Yeah, I mean, I guess that there's lots of presumably there's lots of sort of health justice campaigns around Maori health and making sure that they have some kind of parity these days. Because yeah, I like that interesting idea of what did you say it was a
Bicultural.
bicultural
Yeah.
bicultural because it isn't yeah, you're right, it isn't a multicultural society. They don't have big immigration, do they?
No, it's interesting. I mean, a lot of the Polynesian people and the Pacific Islanders have rights to be there, and they've got a huge mobile population of people who come in from those areas to work and go out again seasonally. And one of the phrases I heard a lot, because to my eyes, the idea of bicultural, when you clearly got several ethnic groups there, is that what they said is what's good and what works for Maori is good and works for anyone who's at disadvantage.
Of
And I thought that
course.
was really powerful. And because their rights are enshrined in law, whereas the others aren't, that's a fantastic lever to address inequality and disadvantage. Now, it seems a little strange to our eyes when we try to be as equitable and fair as we can right across the board. But actually, when you frame it in we do it for these, so we do it for all who are disadvantaged, it actually makes a lot more sense. And I was blown away by the initiatives they're taking. It was very exciting to see.
Oh, bless you. And you think you've picked up COVID on the journey, on the plane?
I'm pretty sure it was on the last leg of the journey home.
Oh,
And there was somebody a few rows back who was coughing their way through the journey.
you
But
see,
anyway,
I'd love to go. I've never been to New Zealand or Australia. I'd love to go, but it's a long old way, isn't it? I mean, you have got to have quite a few good books, haven't you?
yes, you do. I mean, we have family in Australia, so we've been to Australia quite a few times over the years. But realizing that New Zealand is still 4 hours further on than that is quite a bit.
Indeed.
One leg of our journey was 17 and a half hours, just one flight. So yeah, it was
So
a
you could
lot of
listen
fun.
to all the podcasts we've done so far, and you still wouldn't get you there, would it?
Actually, we're on 30 podcasts. You'd be well on your return journey, actually, thinking
Oh,
of
would you? Okay, right. Well,
it.
it was great to have you back and
Thank you.
safe and sound. Yeah,
Tell me
we've
about
been
you.
knocking up the miles recently because I'm talking to you, which is rather my strange good eftermiddag greeting is that I am in, for the eagle-eared among our listeners, I'm in Stockholm in Sweden this week with the Health Select Committee. Have you been to Sweden?
I haven't. No, I'd love to visit. It's a fascinating country.
really beautiful. And we're recording this on Tuesday afternoon, and the weather was gorgeous when I left London on Sunday, and it had been gorgeous on Friday and on Saturday. And it is like that here. It is very hot, blue skies, and it is a very beautiful city, Stockholm. And I have to say, with lots of incredibly beautiful people, I feel very unbeautiful and fat a lot of the time. But we're here with the select committee. We're doing it sort of part of our prevention inquiry. So we're looking at their addictions, alcohol and drugs and gambling and tobacco, and talking a bit about men's health. So I mean, like you, I mean, there's so much we could say about what we're doing here. One thing that is I'll tell you about is that with regards to tobacco and smoking, because obviously the tobacco and vapes bill going through Parliament in the UK at the moment, and you would think, wouldn't you, in these sort of Scandinavian liberal-minded countries, that they would be quite a long way ahead of us on their tobacco control. And in some ways they are, and in other ways they're not. So I'll tell you what I'll do. I'll send it to the producers of the podcast, and we'll pop some pictures up online that I took in a store last night, where cigarettes on display, no cover, branded, so you can say, I'll have a packet of Marlboro, please. There they are. Yeah, they got the health warnings on them, but more worryingly, Helen, and we should get a guest on and talk about this one day, is that what they have is rows and rows and fridges upon fridges of snus, white snus, otherwise known as nicotine pouches. Now, have you heard of Velo nicotine pouches?
I've heard
They're
of
like
it.
tiny, they look like little bits of chewing gum. And
Yeah.
they're in a little tub, which fits neatly in the handbag. So they're a bit of a fashion accessory. And you put them under your top lip. And several, in fact, young people quite like doing so. And they are a nicotine hit, a big one. And some of the little pouches can be the equivalent of 10, 12, 15 cigarettes. They're not tobacco, they're nicotine hits. So the industry, of course, losing out as smoking rates fall in the Western world. They're not daft. They've got vaping, as some of them are in that game, but they've also got now these pouches. And I tell you this, if we don't get a handle on this, it is a public health crisis that is coming down the track like an absolute tanker. And it's going to hit us really, really hard because it's addicting people to nicotine. So we've been looking at that. The only other thing I would say about Sweden, is on the alcohol side of things, is that they have complete state control of alcohol sales here. I had no idea. And we met with an organization today that's called Systembolaget. And what they do is they basically regulate all alcohol that's sold in the off trade, so not in bars and restaurants, but there's no bargain booze, there's no off licenses here. There are state-run stores which look a bit like Waitrose Wine, who went into one today to talk to the team there, and they are state-run and they sell the booze, and they're only open from 10 a.m. till 7 p.m. is it, or 8 p.m., but a limited time each day, Monday to Friday. They close at 3 p.m. on a Saturday, and they're closed all day Sunday. And that's it. That's the only way you can buy booze to take home. And so it's no cheaper than it is in bars and restaurants. So the idea of young people in our culture loading up, preload as they call it, and then they go out already smashed. No, you can't do that here. So it's very, very tightly state controlled. And they said to me, we'd never be able to start from here. Do you think you'd be able to do it in your country? And I said, I think we'd have a combination of the poll tax riots and the peasants' revolt of the 17th century. I think there would be riots on the streets. But the fact that there would be is sad, because when some of the alcohol damage that you see in society is truly, truly horrendous. But that's what they do here. Fascinating,
really
isn't it?
It is fascinating, because I mean, over the years, you mentioned Australia earlier, and I remember first time going to Australia, seeing some liquor stores as being, very little and only low percentage alcohol being sold in supermarkets. I've been at the Middle East, where the only way you could get alcohol was to have a registered liquor license and go to liquor stores to buy it. So there are various models around the world. But it's fascinating to hear about it. You also mentioned gambling and work they're doing out there. That's something we haven't talked about on the podcast. And I do think we should perhaps talk about gambling addiction as in the future podcast, Steve.
Definitely. So just to close on alcohol, next week on the select committee, we are going to be talking to Adrian Chiles, who has
Oh,
agreed to come on the podcast, who wrote a book called The Good Drinker about
yeah,
normalizing drinking at a
yeah.
very young age, which is what happened to him. And he is a reformed alcoholic. We're going to be talking to him. And then on gambling, at some point next month, we're going to be talking to Paul Merson, the former Arsenal football player who very famously fell from grace with alcohol and gambling addiction. And we're going to be talking to him about gambling addiction. And yeah, I mean, I think it's interesting the way that they handle it here. I think we probably have more restrictions in place than they do actually. So you can't gamble online with a credit card in our country. The theory being you can't borrow, you can't gamble with money you don't have. You
Yeah.
can here, and they regulate it as much as they can. But of course, online gambling is where it's at,
Yeah,
and
absolutely.
you don't have to be sitting in Stockholm. You can be anywhere, and you can be gambling anywhere in the world while sitting in Stockholm. But
Yeah.
yeah, no, gambling is a fascinating issue, and how you prevent that. My goodness, there's a whole series of podcasts
There
on
is.
that.
There is. Do you think we should move on?
Yeah, let's take a quick break, and then we'll talk about birth trauma.
Welcome back. I've had a chance to blow my nose, and all is well with the world, Steve.
Glad to hear that.
Right. Birth trauma. Really thought we should mention this. There has been a huge report out commissioned by a parliamentary group about birth trauma, but this isn't one of your health select committees, is it, Steve?
No, it's what's called an all-party group, which is not an official committee of the House, but it is a group of MPs who come together cross-party, hence the title all-party group, who do inquiries on all manner of things. And this one is led by Theo Clark, who's a Conservative MP, and Rosie Duffield, who people may know is a Labour MP in Canterbury, and they have produced this massive report into birth trauma, which has had major pickup on the media here this week, of course.
It's been harrowing to read some of it. I mean, I've not gone through the report in full. As you said, it's a huge report, but there have been some pretty awful stories hitting the media. And I think for me, the bits that stand out, I mean, there's two sides to it. There's the cultural issues, and we've heard about culture time and time again when it comes to maternity services in the UK through many reviews. But also there's a big issue about insufficient staffing levels in maternity units. I don't know what your takeaways from it have been.
Yeah, so I mean they've got 12 recommendations, and again we'll pop the link up. I mean they talk about a maternity commissioner who would report to the Prime Minister, and so recruit and train and retain more midwives, obstetricians, anaesthetists to ensure safe levels of staffing in maternity services, right the way through to a 6-week check post delivery with GP for all mums.
Mm.
Um, Separate questions for mum's physical and mental health. Yeah, quite a lot of stuff around birth safety and birth follow-up, and around respecting mums' choices about giving birth and their access to pain relief, and keeping mums and babies together as much as possible. And this is all based on experience. So the Theo Clark MP had a very, very bad birth
Yes.
trauma experience, which is what
Yeah.
led her to it. And I think she put this out there at the start of the inquiry, and was just absolutely overwhelmed with the response. So yeah, all power to them. And it just shows that when an all-party group of MPs come together, they can do some really remarkable things. And it's been well received by the Secretary of State.
Yeah, good. Well, yeah, let's hope some good comes of it. Steve,
Yeah.
you wanted to talk about obesity.
Oh my goodness, yeah. So this was a story in the Times on the weekend which said that obese people are twice as likely to take time off work, fueling a crisis that is stifling Britain's economic growth, they said. Data representing millions of workers across Europe found that people take more sick days the heavier they are, owing to complications including joint pain, diabetes, depression, and heart disease. They are 2.5 times more likely to have had at least 1 week off with poor health in the past year compared with those of a healthy weight. Now, this we knew, didn't we?
Yeah.
Preventing ill health is about preventing, obviously, you getting sick, but it's also about preventing you from being in the workplace and being economically active.
Yeah, it's a really difficult one. So in a sense, yeah, there's no surprise to read this, and it's only put into a formal thing what every GP would tell you. But I'm also very conscious that we have a huge issue with prejudice against people who are overweight and obese. And the reasons why people are overweight and obese are very complex. And there's an awful lot of social factors at play here. I mean, the environment in which you live and work. We are in a highly obesogenic environment, and those who are more socially disadvantaged are in a more obesogenic environment than those who are more advantaged. So I'm always conscious of that. Um, but I mean, it's helpful material, it's helpful evidence to add to, in a sense, what we already know. I wanted to move us on to weight loss and actually medication for weight loss.
Oh,
Because,
the Wegovy.
yeah, so as you know, my clinical practice is in quite a middle class area in Lichfield. And I've spotted a massive increase in notifications about our patients going to private weight loss clinics to get Wegovy. Now, these clinics write to GPs of patients asking us to double check patient records, check patients if there's no medical reason why they shouldn't have the drug. Obviously, there's a minor matter that this is additional unpaid work for GPs. When patients go to the private sector, they always assume there's no work for the NHS. Actually, it all creates work for the NHS, but that's an aside. And there was a TV documentary recently about just how easy it is to get these weight loss drugs prescribed. However, we are in an environment where these drugs are in short supply, and there is clear national guidance out there that these drugs should be reserved for patients with diabetes. There isn't sufficient supplies currently for those with diabetes who really need them. It's what they were originally designed for. So I have to bite my lip when I get these letters back saying, is there any medical reason why your patient cannot have this? Obviously, I check the records carefully. No, almost invariably, there's no medical reason why the patient can't have them. The only medical reason I can come up with, which I'm shouting at the computer, is that except these drugs are in short supply and should be reserved for patients with diabetes. Am I overreacting, Steve?
Well, no. And in fact, it's interesting that I was talking to a urologist here in Stockholm who listens to our podcast. I think she was looking us up before we came out, and she must have found our podcast. And she said she'd listened to a few of them, but she referenced this story about Wegovy and diabetes.
Yeah.
And so it's interesting how studies and work that's done in our country is read around the world, and it's of interest. But I mean, med shortages is an issue here, as it is back in the UK, and the work's been done by this Dean John Deanfield, Professor Deanfield. Now, I'm guessing you know him, right?
Yeah, I did. John's great. Yeah.
And what's he? Is he UCL?
Yeah, I think he is actually. And there's me thinking, well, I think he's UCL. Yes, he is UCL. Yeah. But and they've done brilliant work, proving that these drugs have even more benefits. Is that what you're alluding to?
Yeah, and it's just fascinating how the work that's done in the UK and the research that's done is picked up wherever you go in the world. And we've had a few sort of sideswipe comments here about Brexit in the last few days, and I sort of said to them, look, I am no fan of Brexit, but the fact is, we left the political institutions of the EU, we didn't leave Europe, and we're still. Actually, you need to hear what we're doing as much as we need to hear what you're doing, and they all get that, and so there's huge respect for the work that John's done, and this obesity time bomb that is ticking, and in some cases has already gone off, is impacting on people being in work, as we said at the start of this item. But also there was another story in the papers when you were away, actually, and even more evidence about the cancer obesity link. And it's just so heartbreaking that this is we're talking about prostate cancer today here in Sweden. This is not a cancer that we can prevent. It seems we don't really know. It seems to be some familial genetic link, but and a lot of it, the great risk factors, aren't they, are ethnicity and age. And obviously being a man would help. But that's not something we can prevent, and yet obesity, in by and large most cases, is something that we can deal with, but we don't seem to want to as a society, or we don't want to enough to intervene.
Yeah, and I think so. Look, let's putting this issue about this particular drug, Wegovy or semaglutide. The evidence that John's team has come up with is that these injections could reduce the risk of heart attack and stroke, even if they don't create much weight loss. Because in some people they don't give much weight loss, in others they have fantastic weight loss. And what they're saying is that ultimately these could be like the statins, the next thing is statins. The problem is they're horribly expensive, currently in short supply. So I think there's something about a realism about if we are to embrace these kind of medications, A, they're going to have to ramp up production massively. The cost is going to have to come down, otherwise it's going to bankrupt the NHS or individuals. And we need to think about, is it cheaper to have a society that is better able to prevent obesity in the first place or pay for the drugs to help treat it? And I think those are quite complex political questions to be answered in the future, as well as philosophical ones.
Yeah, indeed. Right, shall we do this? Pod surgery is back. Anyway, you got one. Dear Stephen Helen, who's this from?
This is from Claire Kavanagh from the National Diabetes Prevention Programme, who reached out to us on our LinkedIn account, asking us to give a heads up to the Diabetes Prevention Week, which is coming up next week. So they have doing some pretty awesome work. So the Diabetes Prevention Programme, well, you can look it up. We can put the link to it on the socials, but there is huge resource out there for people to reduce risk of getting diabetes. The focus of Diabetes Prevention Week, however, which is a collaboration between NHS England and Diabetes UK, the brilliant charity, is actually about creating healthier societies. And there's a focus in this election year on the political parties and what we can do better. I don't know, are you aware of all this, Steve?
Yeah, I mean, I did a lot with Claire and the Diabetes Prevention Program when I was in office, and it's actually a really good thing. It's a really, really good thing. And Chris Askew, who we both know, who used to lead Diabetes UK before he went off to your old Royal College, where he's now chief executive, they do the lion's share of the work on it, and it's good stuff, isn't it?
It is. I've had several patients who have really turned their lives around and gone from being pre-diabetic back to not being pre-diabetic, so normal, and several patients who are early stage diabetes who are in remission from that, and that is a really positive thing.
Yeah. So that's Diabetes Prevention Week, which is what, from next Monday, the 20th of May, through until the 26th.
Yep.
Yeah. So I mean, the thing is, it's always a challenge, isn't it? It's about eating healthier, but when the food, I mean, I know inflation is coming right down, and that's great, but the fact is it's not minus, is it? And therefore prices are still rising. They're just not rising as fast as they were, and food inflation is still pretty high. Because I don't know about you, but we seem to go shopping, and maybe this got two teenagers in the house will not assist, but we seem to open the fridge having just gone shopping and there's nothing there, and then they complain there's nothing there, which anyway. Eating healthy and eating well on a budget is incredibly difficult, isn't it?
It is.
Next item in pod surgery was whooping cough. What's the clinical name for whooping cough?
Whooping cough, pertussis.
Pertussis, that's the word, or 100-day cough, which we talked about on the podcast before. Now
we have.
The reason this is coming up, it's pretty awful news. I think while you're away, this sort of came up, is that 5 young children have died from it. And when I say young, we are talking a couple years or less. Vaccination rates have fallen in recent years across the country, both in programs for pregnant women and, of course, the infant program. So, as you know, the prevention inquiry that we're doing on the select committee, we did vaccination as our first piece of work. Probably one of the greatest success stories when it comes to preventing infection. But the truth is, Helen, England didn't meet the 95% target for any routine child immunisations in 21-22. The NHS then published their vaccination strategy at the end of last year, which was great. We welcomed that. But, they've got a real lot of work to do to now implement the strategy. So to reach communities where vaccination message might not have got through, I think they've got to be much more flexible in the delivery routine and the model for delivering vaccinations. So, medical and nursing students getting back recently retired roles, giving them a role in immunization delivery. Because, I mean, you see whooping cough in your surgery?
Yeah, occasionally. We do see cases occasionally. I mean, I haven't seen anything recently, but mind you, I've been out the country for a couple of weeks. But yeah, we do. And it's, the worry is the very, very young, the sort of the babies whose mums didn't get immunized in pregnancy, or who are just starting their course of immunization as toddler, as babies. It's quite an interesting one with whooping cough. It's one of the few things where we've immunized pregnant women. So that because there's recognition that new babies are really vulnerable to this. And so to give them immunity, you actually vaccinate pregnant women. It hasn't always been that way, but it is currently. And but of course, women can be reluctant to have vaccinations in pregnancy, as we've seen with COVID and flu vaccinations, because those are the other two that we give to women in pregnancy. But actually, it's a very safe, very effective thing to do. Protect
So
yourself
when
and
you're
protect
having
your baby.
conversations with, sorry, when you're having conversations with pregnant women, do you find resistance then? Do you find pushback on it?
Yeah, absolutely. Because we've developed it, we have such a strong culture of not taking anything artificial in pregnancy. Women who are pregnant are reluctant to even take paracetamol, which incidentally in normal doses is very safe in pregnancy. But they try, we try culturally to make pregnancy a time when you as natural as possible, and then we suggest sticking several needles into you to give you vaccinations. People struggle with the concept, but actually we really need public role models out there. We need celebrities reassuring how safe this is, how important this is, and it's a protection for mum and baby, particularly with pertussis. It's a real protection for baby.
Yeah, that's worry. And final one on pod surgery, or penultimate one actually, is one other thing that's just crossed my mind. Where so many people get in touch about infected blood, which is
Yeah,
probably the biggest scandal in NHS history.
tragically.
And there is the final report from the public inquiry is due out on Monday, on the 20th of May, and there will be a big statement, I presume, in the House of Commons, and I will obviously be there for that.
Yeah.
Um, as a doctor, could you
Mm.
summarize in a sentence what infected blood scandal is for the listeners?
Yeah, of course. So, back in the 70s and 1970s and 1980s, people with specific health conditions, mostly hematological disorders and thalassemias, were given wonderful new therapies which were life prolonging and life saving, which involved pooling the blood of hundreds or thousands of donors to create, pools of these factors that could make them live healthier lives. Okay, so it's dealt with their clotting disorders. However, because we didn't have sufficient numbers of donors in the UK to create these agents, the UK NHS bought in supplies from America, which did not have safe checks in place on the donors giving the blood. And in fact, people were being paid to donate blood. A lot of prisoners were doing so as a way of earning money, drug users, and the bloodborne viruses, which at the time were unknown, got into this blood, and so people were unwittingly being given hepatitis and HIV. And the scandal, I mean, that's a tragedy in itself, but the scandal part is that people started raising concerns in the early 1980s, when HIV was first emerging on the scene, and the concern is warnings weren't acted on quickly enough to pull these products from the shelves. And that, I think, is the essence of the scandal. And certainly when I was involved as chair of the Royal College of GPs, the early stages of this inquiry was happening, and we were helping with that, because obviously GPs have helped patients live with the consequence of this for many years.
Yeah, interesting. Well, when the report comes out on Monday, it is going to be, I can predict, a very, very, very big news.
Yeah,
And the government's response is going to have to be very big
big.
too, because actually the scandal of what happened that you've just eloquently outlined there was made so much worse by how long it's taken
Yes,
through the
decades.
whole of the Tory government of Thatcher and Major, all of Blair, all of Brown, the coalition government, Cameron. No one's answered this properly yet. And Monday needs to be a watershed moment. So it's going to be big. And just finally, I was going to say, we talked a lot about assisted dying and suicide, assisted
Yes.
suicide on this thing. So the Isle of Man, I think we said, would probably be the first part of the Crown
Yeah.
dependency to move on this. They got big votes this week, and they're going to decide whether these lethal drugs should be self-administered or given to those eligible by doctors. And royal assent is given next year. This could become a thing in the Isle of Man as soon as 2027. So that's why when the Select Committee did our big report on this, we said whatever the Westminster Parliament decides, it needs to be ready in case another Crown dependency or part of the UK decides to go down a different route on this. And ministers, to their credit, said yes, we will be absolutely ready for that when that happens, and we'll respond to it appropriately. They're going to need to be, because I think the Isle of Man are going that way.
Yeah, it was always looking that way, wasn't it? So
Yeah.
thanks,
Um,
Steve.
quick update for you on Monty,
Oh, good.
my black Labrador. Well, I mean, the thing is, Helen, he's so black and it's so hot.
Oh, he
So,
can't sit in the
he just
sun.
completely attracts it. He came out on the golf course with me on Saturday, and well, he goes crazy on the golf course. But
Yeah.
he would. It took us 4.25 hours to play golf. Now he would run for 4.25 hours if I let him. So on the first few holes, he went crazy, stole some golf balls
Oh
from the
no,
green. Yeah, I know.
that
And
dog.
thinks he's helping with the golf balls that he takes. But yeah, he had to be on the lead, which he after this, which he didn't appreciate. And it was really for his own good, Helen, because he just runs, just gets crazy hot.
Oh,
So he's all right actually. When we got home, I hosed him down, and then I hosed my son down as well because he was muddy. So I hosed them both down. I hosed him
does
hosed them
Monty
like dogs.
does Monty need like a little dog umbrella to a parasol to keep the sun off him?
When he did sit under, he actually stopped after 12 holes with William, my son, and sat under the parasol on the
Uh,
terrace of the golf
Lots of
club waiting for
water.
us to finish.
Keep him
So
well
he was
hydrated,
sitting.
love him.
Yeah, he was sitting under a parasol being fanned by William, I think. Honestly, the life that dog leads. And it's
Anyway,
of course this weekend on Saturday is his fifth birthday. His special
oh,
day.
well, happy
I know.
birthday, Monty.
I will be tweeting pictures of him on Saturday. Bless
I
him.
do
Yeah,
look
we got
forward to seeing.
gifts. There's gifts, edible gifts, cuddling gifts, all sorts. New collar lead will
He
be
is a
coming.
very spoiled dog.
I know he loves it.
Just saying. Right.
Anyway, listen, feel better
Thank
because I
you.
know it's rubbish and you've got to
Oh,
keep
it'll
going
pass.
and all that stuff. But listen, it's great to see you back and lovely to chat.
Take care.
Podcast at stevebryan.com will find me and Helen for pod surgery and for ideas and comments. Find us on all the old social media channels that you know and love. And until next time, when we'll be back with episode 31. Thanks for
Bye.
joining us. See you next time. Bye.
Take care.